morning, ladies and gentlemen. Today I'm going to present the topic about the sarcopenia and hip fracture. And so here's my disclosure. And I'm Ivan Now. I'm a physiotherapist from Hong Kong Queen Elizabeth Hospital. And I've been more than 8 years of clinical experience in the physiotherapy and orthopedics and traumatology. And I've started my works in sarcopenia and hip fracture since 2016. And I've also devoted into my clinical works in hip fracture patients even during the COVID pandemic. So today I would like to share my expertise topics, which is the sarcopenia and hip fracture. And here's my content.
21.
And so first of all, what is sarcopenia? And this is defined as a low muscle mass, muscle strength, and low physical performance, and this is associated with poor health status and adverse health outcomes. And it will cause frailty, fall-related injuries, and subsequent facility fractures, and hospitalization and mortality in our patients. And it can subcategorize into primary and secondary sarcopenia, and also acute and chronic sarcopenia. And aging remain the primary sarcopenia causes, and our muscle mass will reach the peak at our early life around the age of 40. And our muscle mass and muscle strength will progressively decrease for each year until reach the threshold of sarcopenia. And how about the secondary sarcopenia causes? Disease is one of the causes. And here's the proposed model of the age-related muscle loss by the episode of acute illnesses or a major disease with accelerated muscle loss with each episode. And also inactivity, which is the more backbound for our patients, or hospitalization, is another cause of secondary sarcopenia with both decrease in muscle mass and muscle strength, and which is the most rapid during the initial days and weeks. And you can see that it occurs mostly in the lower limbs muscle, and also our older adults will have higher rates of muscle loss compared to the younger adults. And according to the meta-analysis published this year, and you can see that muscle mass and muscle strength is the most rapid decrease during the first 10 days, and will gradually plateau with days. And malnutrition is another causes for secondary sarcopenia, which is associated with weight loss due to the depletion of muscle mass, causing muscle strain, function decline, and causing sarcopenia. And sarcopenia is also associated with lower quality of life, falls, disability, metabolic effects, and other multi-comorbidities, and etc., causing metabolic disorders, disability, mortality, illnesses, and infection. And fall is our main concern and is a consequence which causes hospitalization and also mortality as well. And so I will go through the sarcopenia and fragility fractures relationship to you now. And fragility fractures is very common in elderly. For each elderly more than 80 years old, nearly half of them will sustain more than one episode of fall for each year. And some of them will sustain from, and this will further impose increasing risk of secondary fractures. And sarcopenia remains the significant predictor of fall and causing subsequent fragility fractures. And hip fracture is the most prevalent in our local data. And the prevalence of sarcopenia in hip fracture is high, as shown in the literatures. And there's an interrelationship between the osteoporosis and sarcopenia as well, in terms of developmental, endocrine, physical activity, nutrition, and etc. And I would like to highlight the mechanostat theory that muscle imposes mechanical forces on bone. As you can show that it's shown on the right-hand side on the graph that if the force exceeds the threshold, the equilibrium of bone turns over will shift from bone resorption in favor of bone formation and vice versa. And this occurs as increases in muscle mass induce the stretching of the bone, which results in the stimulation of bone growth. And so, in short, sarcopenia and osteoporosis are interrelated biologically and functionally with aging. Altogether, will cause fragility fractures. And according to our local data, hip fracture is the most prevalent fragility fractures causing disability and dependency in our elder patients. And so our clinical implications is that we should identify the sarcopenia patients with early individualized rehabilitation and fall prevention accordingly. And so we have to go through the diagnosis first, so as a screening. And according to literature, there's two main groups for the diagnosis algorithm. The first one is the Asian Working Group for Sarcopenia. And we can find the case in primary settings by simply the calf measurements and also some simple questionnaire of sarcopenia, followed by the assessment of muscle strength or physical performance to identify the possible sarcopenia, and refer to the clinical research setting. And with the diagnosis by assessing muscle strength, which is hand grip strength, physical performance, and the muscle mass, which is measured in terms of appendicular skeletal muscle mass index by the means of DEXA or bioimpedance to further confirm the severity of sarcopenia in our patients. And the second algorithm is established by the European Working Group on Sarcopenia in older people 2 years ago. It said that we can assess firstly the muscle strength by hand grip strength, for example, to identify probable sarcopenia and confirm the diagnosis by measuring the muscle mass by DEXA or bioimpedance, and confirm and determine the severity by the measurement of the physical performance accordingly with the cutoff here. One by one. For the questionnaire, which is an SARCF, which is a simple questionnaire to diagnose the sarcopenia with only 5 simple questions with the cutoffs as shown. And SARC-CUF further improves the sensitivity of the previous questionnaire by adding the measurement of calf circumference. Hand grip strength is proven to be evidence-based and validated measurement to assess the whole body strength. And it is simple. And according to the literature, there is no difference in hand grip strength in either sitting or in lying positions. So this implies that hand grip strength can be assessed in community settings or even in the hospitalization settings. And it is shown that low muscle strength is a predictor of osteoporotic fractures. And hand grip strength can also predict the persistent walking recovery after hip fracture surgery. And 5-time sit-to stand test is another test to test the lower limb muscle strength or physical performance. It counts the amount of time for the patients transfer from a sitting to standing position back and forth for 5 times with the cutoff as shown here. And DEXA is known as the gold standard to measure the bone mineral density for our patients to assess the osteoporosis. But it can also be utilized to assess the sarcopenia, which measure the height-adjusted skeletal muscle mass index. However, some may say that DEXA is relatively expensive and it is not portable. So bioimpedance is another method to measure the skeletal muscle mass index. It is relatively affordable, portable, can be used in the community setting. And 6-meter time walk, which is assessment of the gait speed, is can use to assess the physical performance of our patients. And SPPB, which is a short physical performance battery, is another measurement for the physical performance for your reference. So with the development of the assessment, there's more and more outcome measures for sarcopenia. And I would like to introduce briefly here is the mini sarcopenia risk assessment, MSRA, with 7 items in one questionnaire with high sensitivity. And the Sarcopenia QOL questionnaire is also a specific health-related quality of life questionnaire for sarcopenia and for clinical and research purpose as well. So after this, I would like to go through the fragility fracture management and sarcopenia management. And 4 is the main cause of the fragility fractures. And sarcopenia remains the main intrinsic risk factors. And of course, there's other intrinsic risk factors and extrinsic risk factors to cause 4. And sarcopenia screening, which I have mentioned in the previous slides, is very important. And of course, as a physio, we can do some other measurements as well. And exercise is one of the expertise for as a physiotherapist to prescribe aerobic exercise or resistance exercise for those patients with sarcopenia. And we can also perform gait analysis, balance training, vestibular physiotherapy, home assessment and modification, education, and also walking aids prescription. And the systematic approach of fragility fractures is also important. And in short, so as a clinician or physiotherapist, we should assess the patients with osteoporosis with sarcopenia and determine the rehabilitation outcomes and rehabilitation potential and maximize their functional outcome. And since my works and publications 5 years ago, I would like to share my works here. And I've published some posters and presentations in local and also the international conference in Japan and France. And I would like to share my recent publications this year in the Journal of Orthopedics Trauma Rehabilitation, entitled as the Prevalence of Sarcopenia and Association of Sarcopenia, Premorbid Factors, Early Functional Outcome, and 1-year mortality in fragility hip fracture patients. And here's the introduction that DEXA is known as the gold standard. However, it is relatively high cost with high demand. Meanwhile, there's a limited studies on physical performance factors in patients with hip fracture. Therefore, our first objective is to investigate the correlation of sarcopenia and different physical performance factors. And on the other hand, sarcopenia is cause the healthcare burden. Therefore, rehabilitation plan and prognosis important and can be determined by early functional outcome. And at the same time, 1-year mortality of the hip fracture in Hong Kong, which is local data, remains high, which is the 18%. At the same time, there's a limited studies investigated the contribution from sarcopenia on the functional outcome and 1-year mortality. And therefore, our second objective is to investigate the correlation among sarcopenia, early functional outcome, and 1-year mortality. And this is a retrospective study with ethical approval. Patients admitted to the local acute hospital in Hong Kong for 1 year and referred for the DEXA within 1 month were retrieved in the data analysis. And first of all, we will measure the muscle mass index by the DEXA, and we will assess the hand strength, which is a measurement for the muscle strength, and measure the new mobility score, MFAC, modified Balfour Index as a physical performance factors. And we will follow up the post-operative outcomes, which is the cumulative ambulation score and elderly mobility scale at the post-operative stages. And we will follow up the 1-year mortality rate, which is retrieved from the local data set. And the methodology is that we will study the correlation between the muscle mass index between hand strength and physical performance factors by the means of Pearson's correlation and Spearman correlation analysis, respectively. We will also study the relationship and the correlation between sarcopenia and functional outcome and 1-year mortality by rank by zero correlation and Pearson's chi-square analysis, respectively. And here's the results. And you can see that the prevalence of sarcopenia in male and female patients in hip fracture is relatively high and consistent with previous study. And the muscle mass index, which is the sarcopenia, is positively correlated with hand strength and different physical outcomes. And sarcopenia is also associated with 1-year mortality in hip fracture patients. And patients with sarcopenia were more likely to face the mortality within 1 year, as shown here. And the discussion is that because there's higher prevalence of sarcopenia in hip fracture, screening of the sarcopenia in community is very important. And also it's shown that there's a positive correlation between muscle mass and different outcomes. And there, among them, hand strength and NMS can be easily administered and therefore can be used for as a cost-effective screening method and also for the secondary fall prevention measurements. And sarcopenia is also correlated with functional outcome, and it is very important and it's possible prediction of the rehabilitation outcome and for our early discharge planning. And sarcopenia is also associated with 1-year mortality, and it is help us to predict the prognosis as well. So this echo the clinical implications that we should early identify the patients with sarcopenia by measurement of hand strength and etc. to determine decide the early rehabilitation and followed by the secondary fall prevention. And in my opinion, obesity is the future development in the future studies. To conclude, sarcopenia, falls, and fertility fractures result in significant healthcare expenditure and economic burden. Hip fracture is the most prevalent fertility fractures, and sarcopenia is one of the predictors of fall and fertility fracture. Therefore, screening, assessment, and treatment of sarcopenia is crucial in different settings. And thank you for my colleagues and my department for the support. And here's the reference list. This is the end of my presentation. Thank you.
Now I would like to thank Dr. Ivan for your wonderful and informative lecture.